You might notice things aren't working quite like they used to. It is easy to blame aging, but I'm here to tell you that half the decline you are feeling isn't just your age, it is your habits. You are doing things every day, from how you shower to how you brush your teeth, that are actively accelerating your decline. I'm Dr. Greg Sean. I've been a board-certified urologist for over 25 years. I've helped thousands of men over 50 reclaim their vitality, fix erectile dysfunction, and avoid the operating room. My job is to keep you healthy, active, and intact. Today, I'm walking you through the 11 things you must stop doing to protect your manhood as you enter your prime years. Number 1. Restricting blood flow and overheating. In your 20s, you could get away with tight clothing, but in your 50s, your testosterone production is naturally declining. When you wear tight underwear or trousers that overheat the testicles, you are accelerating that drop. You are preventing nutrients from reaching the tissue. Here is what you should do. Sleep loosely. Stop wearing restrictive underwear to bed. You need nighttime circulation for recovery. Size up. A practical tip I tell my patients is to buy your underwear one size larger than you think you need. Give the boys room to breathe. Number 2 might surprise you. Brushing your teeth incorrectly. You might ask, "Doc, what do my teeth have to do with my package?" Everything. A 2012 study found a strong correlation between periodontal disease, gum disease, and severe erectile dysfunction. When you have gum disease, that bacteria enters your bloodstream, causing systemic inflammation that damages your blood vessels, including the tiny vessels down there. Here is what you should do. Treat vascular health as sexual health. Floss and brush for 2 minutes daily. Watch for blood. If your gums bleed when you brush, that is a warning sign for your erection quality. Fix your teeth to save your sex life. Number 3. The phone in the front pocket. We have significantly more data on this now. Your phone emits radio frequency radiation, around 2.45 GHz. Long-term exposure to this heat and radiation creates oxidative stress on the cells. You are essentially carrying a radiator next to the factory. Here is what you should do. Create distance. Put the phone in your back pocket or your jacket pocket. Desk habit. When sitting down to work or eat, take the phone out and leave it on the table. Number 4. Laptops on the lap. As we age, our circulation naturally slows down. Placing a hot battery directly on your lap and squeezing your legs together to balance it restricts blood flow to the pelvic floor. Poor pelvic blood flow is a leading contributor to ED in men over 50. Here is what you should do. Use a solid surface. Always use a desk or a table when possible. Buffer the heat. If you must relax in the recliner with your laptop, use a tray or a thick pillow to create a barrier between the heat source and your body. Number 5. Using the wrong water temperature. Many of you love ending the day with a scalding hot shower. However, studies suggest that water 2 to 4 degrees hotter than your body temperature can suppress testosterone production and lower sperm count. Your testicles hang outside the body because they need to be cooler than your core. Boiling them every night is counterproductive. Here is what you should do. Lower the dial. Keep the water lukewarm around the groin area. The red skin test. Aim for a temperature that doesn't turn your skin bright red immediately upon contact. Number 6. High-speed adult content. I see this in my practice constantly. Men in their 50s suffering from porn-induced erectile dysfunction. It desensitizes your brain's dopamine response. If you find you can't perform with your partner but you can with a screen, your hardware is likely fine. It is your software that is the problem. Here is what you should do. Resensitize your brain. Treat this like a dopamine detox and cut the content out. Focus on reality. Prioritize real intimacy and connection, which releases oxytocin and supports long-term sexual health. Number 7 is a medical reality. Disuse atrophy. Use it or lose it isn't a joke, it's physiology. The tissue is vascular and requires frequent oxygenation, which only happens during an erection. In your 50s and 60s, if you stop having erections, perhaps because you are single or practicing abstinence, the tissue loses elasticity and literally shrinks. Here is what you should do. Maintain blood flow. If you have a partner, stay active. Physical therapy. If you are single, view self-stimulation as necessary maintenance to keep the collagen elastic and the blood vessels open. Number 8. Ignoring the warning signs. The human body is like a car. When the check engine light comes on, you don't tape over it. Erectile dysfunction is often the first sign of heart disease or diabetes. If things stop working, it means your blood flow is compromised. Here is what you should do. Monitor morning wood. If you lose morning erections, this is a red flag. See a professional. Do not wait it out. Book an appointment immediately, as catching these issues early can save your life. Number 9. Neglecting hygiene. As we age, our skin changes. It becomes thinner and more prone to irritation. Buildup of bacteria can lead to balanitis, inflammation of the head, which is much more common in older men, especially if you are pre-diabetic. Here is what you should do. Wash effectively. Clean daily with warm water and a mild, non-irritating soap. Dry completely. Ensure the area is totally dry before dressing, as trapped moisture is the enemy of aging skin. Number 10. Shaving recklessly. Listen, your skin loses elasticity as you age. It's looser now than it was at 25. If you take a razor to loose skin, you are guaranteed to nick it. I have had to stitch up men who tried to groom in a rush. Here is what you should do. Ditch the razor. Switch to an electric trimmer with a safety guard. The stretch technique. Always pull the skin taut and flat before you trim. Hydrate. Always apply a moisturizer afterwards to prevent itching. And finally, number 11, sending compromise photos. A lot of you are back in the dating scene. Be very careful. Under no circumstance should you send a picture of your package. It does not turn women on the way you think it does. And once it is digital, it is out of your control. Here is what you should do. Maintain your dignity. Charm them with your personality and your success, not photos. Keep it private. Protect your reputation and career by keeping your private life offline. Gentlemen, your 50s and 60s can be the best years of your life if you protect your hardware. Follow these steps, stay vigilant, and take your health seriously. I'm Dr. Greg Sean. Subscribe for more no-nonsense medical advice. Stay healthy.